Welcome back to Neil Oliver Live. Depression is a fact of life for many people. According to government figures, around 1 in 6 people takes antidepressants. For decades, the medical profession has understood depression to be caused by a chemical imbalance in the brain, specifically relating to levels of serotonin. Research published last month, however, concluded there was no evidence to support chemical imbalance as the cause, and called into question what prescribed antidepressants actually do. Joining me now to discuss this finding and its implications is Dr. John Campbell, a retired nurse, nurse trainer and academic, better known to millions around the world though for his online videos about health and health care. Good evening, Dr. John.
Good evening, Neil. Thank you for having me.
Oh, it's a pleasure. Now, can you explain what this research recently published actually determined?
So for years, since I was a student psychiatric nurse back in the late 70s, we believed that depression was caused by a lack of serotonin, which is one of these chemical transmitters that transmits chemicals from a presynaptic nerve to a postsynaptic nerve, and that when someone was lacking serotonin, that was making them depressed. So they developed a group of drugs called selective serotonin reuptake inhibitors. These are the Prozac type drugs, the fluoxetine type drugs. And what these actually do is they prevent the serotonin from being reabsorbed back into the presynaptic nerve. They prevent the reabsorption of that. That leaves more serotonin in the synaptic gap. So there's more stimulation by this serotonin. And the idea that this is what relieved the depression. And this has been taught for, as I say, for decades now, depression caused by an absence or a lack of serotonin. And these drugs would somehow correct that. But there was a paper published last month in the Journal of Molecular Psychiatry, July 2022. And what it did really, it put together ideas that have been developing for about the past 10 years now, because there's quite a few things about this serotonin deficiency syndrome and causing depression that really didn't make sense. And they put together several lines of scientific evidence. And basically, they've concluded, as a summation really of the work that's been going on for the past 10 years, that in depression, there is actually not a deficiency of serotonin. We've got it wrong for all of these years.
This must have come as a surprise to you, if not a shock.
Well, it's kind of, we've had some inklings of this for the past 5 to 10 years, but this is sort of the peak stone of that, and it's now been accepted by the scientific community. So it was a surprise, but of course that leaves open, how are these selective serotonin reuptake inhibitor antidepressants working? Because there is evidence that they do work. I mean, I'm quite happy to admit that I've taken them myself in a couple of phases of my life, and they have been beneficial. And I've seen them working many times in maybe 1,000 patients, as well as trial evidence that they do work to a degree. So if they're not affecting the serotonin, how the heck are these things working? And the Journal of Molecular Psychiatry concluded that we basically haven't got a clue. So they do seem to be doing something. It might be to do with division of nerve cells in the deeper parts of the brain, but however they're working, it's not related to the serotonin, because the serotonin lack is not correlated with the depression. Kind of adds to the fascinating nature of the human mind, actually, and what we don't understand about it.
Are we into the territory of placebo and nocebo there? Is it the brain, is it the person understanding that this medicine ought to make them feel better, and so they do?
These are massively important effects, Neil, as you rightly say. The placebo effect, meaning you get a beneficial effect if you believe it's going to. And the nocebo effect is also frighteningly real. This is how witch doctors work. They put a curse on you. And if you believe that, then it actually makes you sick, this nocebo effect. But it's actually more than that. I actually did a video on this last week, and about 1,000 people commented on that, saying, well, these things just work by placebo. But there are actually some placebo-controlled trials which show that the Prozac-type drugs, the selective serotonin reuptake inhibitors, actually do work better than placebo. And there's other things that indicate that it's not entirely placebo. For example, when you start taking these, very often they make you feel worse for a week or two before they make you feel better. Also, people can have difficulty coming off them and getting rebound depression, rebound anxiety as well, because these drugs are quite effective for treatment of anxiety and depression. The two can often kind of go together. So yes, there's a placebo effect, but I'm quite convinced, and the literature is pretty convinced as well, that there is more than placebo effect to these drugs, but we just don't know how they're working.
In a wider consideration, particularly really why I wanted to talk to you, we hear a lot now about settled science and scientific consensus, not just about medicine, but obviously in relation to climate change, but specifically obviously in relation to vaccines and whatever. But we're being told, this is all you need to know, this is all we'll ever need to know, take our word for it. Is this a reminder about how when it comes to health and the human body and the brain, that we can never know enough and that we have to be always able to ask more questions?
You know, absolutely it is, Neil. I mean, when I was a young staff nurse, we used to teach that diabetics should be on a diet which was basically high in carbohydrate and low in fat. Now we believe the opposite is the truth. So I've been following official guidelines throughout my teaching career, teaching a couple of generations of nurses. And it now turns out that quite a few of the things that we taught was wrong. Now, a lot of the basics aren't going to change. Newton's laws of motion are still the same. The heart works in the same way. The kidneys are working in the same way. But our approach to therapeutics has changed quite a lot. Some of it, it's actual reversal of what we taught before. Other times it's more a progression of what we've known before. But we always have to have this element of humility that really all I understand about the body, despite having studied it basically all my working life, is a few simplified models of how it actually works. And when we actually come onto the brain with 100,000 million nerve cells with 1,000 to 10,000 synaptic interconnections between each cell, and how the mind emerges from the brain. Actually, no one's got a clue on this. That there is not even really a good theory in town. We know that we're conscious. You're experiencing conscious. I'm experiencing consciousness. We know that the brain is working, but how the brain is generating that consciousness, how you actually take what is basically a few crude molecules and chemicals of the 92 elements and how that comes together to produce this mystery of consciousness isn't known. So it's not surprising that we don't know how the SSRIs work. That's true. And what we need to do really is have generations of empiricism to see how things work. So we know that children get better with breastfeeding. We know we need proteins. We know we need carbohydrates. We know we need fats. These things have been proved over many, many generations. What we've got to be careful of, as you've just rightly pointed out, is introducing interventions that actually can change the physiology of the body before we're really quite sure of what we're doing. In healthcare, we have this idea of the audacity to intervene. That you're sitting there quite healthy, and I dare to do something to you, to interfere with your physiological systems. If I'm going to do that, we have to be pretty confident of what we're doing. We have to approach healthcare with great humility. And of course, we must remember the prime directive is not to do any harm.
Dr. John Campbell, I could listen to you for hours, and I mean that most sincerely, but the time constraints I have upon me mean I have to move on. But thank you 1,000 times for your
Thanks for having me on, Neil. Really appreciate it.
Great stuff. Thank you.
Thanks.
Narinder, what I was coming